Okay. Hello, everyone. I'm Dr. Mary-Zitta Muabe, and I created this platform called the Dr. Mary-Zitta Show. The reason why I created this platform is because I realized that a lot of times people who are not familiar with clinical practice, when they go see the doctor and the doctor says something and explains something about their health to them, many of them are not they cannot understand. Even though the doctor obviously makes an effort to explain this to them, they don't they don't really fully grasp what the doctor is talking about. And of course, the doctor having to see multiple patients, many patients, he cannot sit there all day long explaining to one patient until he or she understands everything, right? So he will give out some pamphlets, some reading materials, and hopefully the persons will read these materials. However, we all know that most of these materials are not being read by these patients. Sometimes they leave them in the car, they leave them in their houses on the table, and then it ends up in the trash can, in the rubbish bin. So they don't really make time to read this. Not everyone, of course, but most people with the busy nature of our lives don't have the time to read that. So therefore, I thought about this. Why don't I create a platform where you tell us what you would like us to break down and dissect? What diseases that you would like us to talk about? And then myself and some colleagues of mine, we will break it down and then we present it to you in very simple English, very broken down terminologies. We will try to make sure that we use the words that are familiar to you, such that when you go to see the doctor the next time, you have questions because you understand. Because you cannot ask your doctor questions if you do not understand what he or she is saying to you. So this is what the Mary-Zitta show is all about. And we'll constantly be giving advice on preventive medicine. We'll constantly be giving advice and then just really talk about the things you like to talk about, but in layman terms, such that we all can all be on the same page. I hope this makes sense. Just let us know, leave your comments, subscribe, of course, and we would answer everyone's questions to the best of our knowledge. Let us make this a learning platform for all of us, including myself, including the other doctors who are going to be coming on the show. Thank you very much and remain blessed. Hello, everyone. This is Dr. Mary-Zitta. Welcome to the Dr. Mary-Zitta Show, where we advise to the best of our knowledge on preventive medicine. Now, this is a platform where we, as young doctors, we are anxious to share and educate with you the little that we know on preventive medicine. Now, there's a whole world of knowledge out there, and we're all still learning. However, we believe that we can share, give a little bit of advice on how to prevent certain diseases. And right now, on the most talked about infection, coronavirus, is one way that we can use this platform to educate you on how to at least slow down the contraction of coronavirus, advise you a little bit on what is coronavirus and what we can do to prevent the spread of coronavirus as well as the contraction of coronavirus. So on this platform today, I welcome a friend, a sister, a colleague, Dr. Isioma. Dr. Isioma, please introduce yourself.
Good night, everybody. I'm Dr. Isioma. Today, I'm all the way here in Guyana. How are you doing? I'm so happy, Zitta, okay, I call her Zitta, but Dr. Zitta, I want to say thank you for inviting me on your platform. I'm really happy to be on Dr. Zitta show. So aside that, I'm just a very chilled person. I'm cool. And, pushing to get things and be better each day.
Wonderful, wonderful. Thank you so much, Dr. Isioma. We are very pleased to have you, and we cannot wait to get this ball rolling, right? Okay.
Yeah.
So on this platform today, today's topic, episode 1, season 1, episode 1 topic is going to be on coronavirus prevention. Now, everyone talks about coronavirus on the news, coronavirus, with friends, coronavirus, at work, coronavirus, in the stores, coronavirus. What is coronavirus? Coronavirus is a virus that causes coronavirus infection.
Right.
Now, coronavirus is a lot similar. It's very much similar to like rhinovirus infection, which is a common flu. So the symptoms mirror each other, and that's why even the season of contraction, it's also the same. It's a cold virus. It's a virus that flourishes in a cold temperature. That's why it starts from the nasal cavity, the nose area, where it's cold and moist, so that it feeds in there, it incubates in there, and then goes down the throat. Now, how do we contract coronavirus? Coronavirus is contracted from person to person. It's an airborne disease, such that when you inhale droplets in the air, when people sneeze, when they speak, when they cough, thousands, millions of droplets go out there. They're in the air. So when you inhale it, you inhale the contaminants of coronavirus. It starts in the nasal cavity, in the nose area. Some of it enters your mouth. So it incubates in the nose area. It travels down the esophagus, down your throat. And as it travels downward from your nose area, you begin to sniff.
Correct.
From your nose area, you begin to sniff. You feel as if you're having an allergic reaction, like flu or sinus infection, right?
Yeah.
So
Sinusitis. Yeah, exactly.
yeah, sinusitis. So you feel like you have that. Then eventually it travels down the throat. And as it's going down your throat, it affects you in a way that you cannot. Then you feel like there's an itching in your throat area, and then you're losing your sense of smell as it goes down. Now then it goes to the chest area, where it meets the lungs. And that's when with the virus being trapped in the gaseous exchange pathway, it affects the breathing process. And that's why it's at that point where some people may express a very severe form of breathing difficulties.
Right.
And at
They
that
have to
point,
miss a prayer and stuff like that. Yeah.
so when the virus has traveled down your throat into your chest area, where it meets the lungs, there's gas exchange that takes place in the lungs. So at that point, carbon dioxide is being exhaled, and oxygen is being inhaled. So it's at that point you get visited by the coronavirus infection. You see cardiovascular symptoms precipitated by coronavirus. You see respiratory symptoms, of course, renal symptoms. So at this point, because the contaminated blood is distributed to multiple parts of the body. So that's why multiple parts and multiple systems also will have symptoms, all of which were led by coronavirus. Do you have anything to add, Dr. Isioma?
That's actually a very beautiful explanation. Only you would have pulled that up, I guess. But that's why it's very important. The only thing I can add at this time is that it's very important. That's why we tell people to keep the social distancing. We're not just saying that because we want people to stay away from other people. Because of course, in the year 2019 and 2018, we're all together. But because of the way this virus is passed, we ask for the social distancing, because if you're close to me, I can easily infect you, right? And that's why we test people who were maybe some people who decided not to obey the regulations that are being put and decide to have a party. we have to actually test everybody because they were in close contact with each other, because they were not following the guidelines of 6 feet apart. So it's very important that we know that. And Dr. Zitta have already done a very amazing way in explaining how this is done. And as we know, there is the primary symptoms that we can see, which will be shortness of breath, the feeling of you think that you have, or rather the feeling of you have cold and all of that. But the adverse effect is what she actually explained, talking about we having multi-system issues. So you could have people who end up with serious lung disease and all of that. So it can even cause more issues. And of course, people who are asthmatic, who have COPD, they need to be very careful. And of course, not to mention the elderly. So we don't want them. We're very careful with these people because they're already fragile and they're already immunocompromised. So we're very careful with them. And that's why we advise that, you know, people who have certain conditions need to take more precaution than any, and we the younger people, because, you know, in as much as our immune system is there, but if you're not taking care of it, you are in more trouble. So that's basically all I have to just add, and because you've already done an amazing job taking us back to med school and bringing us back to reality. So that was beautiful.
Thank you, Dr. Isioma. So you did a wonderful job of recapping, right? And
Well, I guess so.
yes, and
Yeah.
and you actually talked about people with COPD being actually very vulnerable because they already have a condition that makes them have difficulties with breathing. So you
Right.
can see that before this infection coming down to the lung area, the lung is already diseased, such that if you have more stress on the lungs brought upon by coronavirus, you can see that it is such kind of patients that would need a ventilation much sooner than a patient who does not have a COPD. Even patients with bronchitis, you know,
Right.
patients with
Exactly.
asthma, they also are very much in a position where they are very vulnerable to contracting coronavirus and it actually leaving a lasting impact, if not even cause death, because
Exactly.
they're already compromised because of problems with their respiration.
Yeah.
So I think that was a wonderful point, you know, that and that should be noted. All the smokers, be aware of this. You're very, very, very more vulnerable than a non-smoker to
Mm-hmm.
contracting coronavirus and ending up with a ventilator. So now that coronavirus is person-to-person transmission, airborne disease, and all of that, now let's go to how do we prevent it? Because there's still so much about this strain of coronavirus. The coronavirus that we studied in Sketchy Micro was seemed very insignificant. But this strain of coronavirus, it
Yeah.
reminded me of what is coronavirus? Did I ever study something like coronavirus? Because it
I
was
can even
very
remember
insignificant.
that, you know, it was funny because when this came back, I was like, wait, I know we had something on coronavirus, but I wasn't expecting all of this drama. Like, what is going on? So
Yes,
yeah,
that's true.
yeah,
That's very true because the strain of virus we studied in school was is like, and by self-limiting we mean that it goes away by itself, just like the flu. So now let's move to the preventive methods for coronavirus. The very first thing is our diet. What we take in determines or it speaks a lot of our immune system. The things we eat says a lot about the integrity of our immune system. If we do not eat a balanced diet, if we do not exercise, all of
yeah,
this play a factor in the buildup of our immune system. Therefore, if you do not eat right or exercise, you're not feeding your body with the tools that it needs to be robust. You need to eat fish, meat, yes, because you need protein. You need a well-balanced diet, carbohydrates, grains. You need all of these things, calcium, all these vitamins, because your body It has got to absorb these vitamins for it to be used to build a more robust immune system. So you see that even patients who have Crohn's disease,
Mm-hmm.
patients with celiac disease, patients with peptic ulcer disease, patients who have had a gastric bypass, the part of their GI that is diseased, these parts actually are the parts, usually the parts that absorb the vitamins, absorb the nutrients that the body needs to build a robust immune system. So they're not able to absorb vitamins like zinc, and you know we need zinc. They're not able to absorb vitamin B3, B12. They're not able to absorb selenium, all of which are very critical in building a very strong immune system. So
Yeah.
these individuals with these pre-existing conditions, you want to speak to your doctor to see if you need to be on extra vitamin pills. But aside from that, we recommend, of course, multivitamins. Yes, you eat right, but it's not all the time you think about eating right, right? So just to be on the safe side to make sure that you have all your vitamins, just take a
Yeah.
multivitamin. You don't need to be sick to take a multivitamin. You take this and your body absorbs it adequately. It now builds a strong immune system. And then not only coronavirus, but other infections.
I agree with what you've said. Diet is very important, and a lot of people are really lacking that. A next thing for prevention is our lifestyle. Of course, diet is something else, but since coronavirus started, it's very funny that people came out confessing that they don't even wash their hands. They're not even aware that they're supposed to wash their hands before they eat, wash their hands before they touch their face. So
Mhm.
that brings me to the next topic of next prevention, that you have to wash your hands before you do anything. So I'm very meticulous since coronavirus. On how I touch my face. I have to sanitize my hands. I have to make sure that my hands are in the right order, because we move out. We sometimes we might not even be we might not remember to that we just touched the surface, because our minds can be so busy, and then the next thing is we want to rub our face somewhere, scratching, and we want to. So washing off your hands when you go out, wash your hands. For me, I don't like the fact that a lot of people, I know that people have to put the what do you call it, the tub, and with the soap where you have to wash. Okay, over here, it some of them requires you to open the tap and then close it. For me, I don't like that, because I'm going to a supermarket, so I have to wash my hands and I have to go in. Sometimes the tissue might even run out. So a lot of people will have to touch that same type a pipe, and I have to. So it makes no sense. So for me, I prefer carrying my hand sanitizer. So I sanitize my hand right there. Then when I come back home, I wash my hands properly. But if you are on the go outside, I prefer you use your own hand sanitizer than stopping at the mall to wash your hands, because sometimes the tissue papers are finished. Sometimes the tabs are not automatic, that when you put your hand, then it closes it up. No, some of us don't have that. There are some stores that have that. So it's always important that you have your hand sanitizer with you. Before you eat, you wash your hands. When you use, of course, it's bedside manners. When you use the toilet, you wash your hands. You have to, any little thing. If you have children, if you have elderlies, you have to wash your hands. And that takes me to my next point, which I'm going to be adding, which is wiping off the surface. We have to wipe, if it's our our room dividers where we keep our televisions and stuff, our dining tables. Those surfaces have to be wiped regularly. It has to be wiped, because the virus can dwell on these surfaces for if I'm wrong, please correct me, for up to 72 hours. So you have to wipe those surfaces regularly. So, and these are something, these we're saying, they are not new. That's something that WHO have put in the guidelines, but it's so heartbreaking that a lot of people are not still following those regulations. Dr. Zitta, you won't believe how hard it is for people to wash their hands. It's like a problem. And it's funny, but the thing is, nowadays, the people who even wash their hands better are little children because it's like a plaything to them. So they're like, "Mommy, mommy, I want to wash my hands." A lot of parents have confessed that it's their children who keep them up to par in washing their hands because the children are so used to everywhere I go to, I have to wash my hands because most
It's
parents
supposed to be
do
the
for.
other way.
I know, but it's
It's
so
supposed
funny.
to be
It's
the
really,
other
really
way.
funny. It's really
You
funny.
know, well, at least someone is on. At least someone is remembering to wash their
Exactly.
hands. And
Exactly.
I want to
Exactly.
add something on that. A lot of people also they take the fact that hand sanitizers, when they have hand sanitizers, they don't need to wash their hands. Hand sanitizer is a chemical and it's not 100% absolute.
Right.
It is not absolute. So especially before you eat, you want to wash your hands, whether or not you just use hand sanitizer.
It's very important. Yeah.
So please wash your hands.
Yeah, it is
Also,
very important.
wipe up the doorknob,
Right,
the
the
light
doorknobs.
switches,
Yeah.
all those common areas, the doorknobs, the light switch, everything that you touch to all the common areas, the
Correct.
elevator button. I don't touch it with my hands. I always have a tissue, a Kleenex with me because I hate to touch it. Or
Yeah.
I use my keys to push the elevator. I don't use my hands. So let's just make this kind of habit a bit more mundane, you make it a bit more way of life. And every little bit counts because this virus actually, you said 73 hours, depending on the surface, if it's wood or steel, it can stay up to 8 days on a face, as a matter of
Wow.
fact. So
Exactly.
way
Wow.
longer. Yes, way longer than 72 hours. That's what makes this virus very vicious because even after a week, a contaminated surface can still be infective. That's what makes it bizarre. Please
That is
continue.
true. Yeah. Okay. So,
Yeah,
but that is true. Everything that is cleanable that you think that can be wiped, let them be wiped as often as possible. It's very important. It's very important. And yeah. So the next thing, the next point I'm going to go to, of course, prevention is that we have to wear a mask. You see, um, if it was 2018, 2019, you were wearing a mask, they would say you're a thief or you're a burglar or something. You're going to, so yeah. But funny thing is that everybody now is wearing a mask.
yeah.
And of course, the mask have its different perks because sometimes you feel like you're choking in the mask and all of that. So it can be um, too much sometimes, you know. But there's nothing wrong if you're in your car. You can always take it off,
Thank
catch
you
your
very
breath.
much. Thank you very much. Can I
Yeah,
add on that? Can I add on
yeah.
that? Please let me comment. I was just speaking to the meeting that I was in prior to meeting with you. I had another conference call and I was educating these uh, uh, wonderful ladies on masks, how to wear masks. So when I'm driving, I see people in their vehicles all wind up with their masks on. Why? If
It's
you are not an
crazy.
Uber driver, a taxi driver, when you have a stranger in your car, it's your territory.
Um,
Pick it up.
I
Because
know.
already it's not natural for us to wear masks to begin with because
Right.
the body is engineered such that your body exhales carbon dioxide, which is waste.
Right.
Therefore, if you are wearing a covering over your nasal, your nose, let me keep it real simple. When you wear a mask over your nose and mouth, you're breathing out the CO2. But because there's not enough gas exchange with the atmosphere, so then you're inhaling the CO2
Right.
again.
Yeah.
So now the CO2 goes into your system, into your blood, and it makes your blood more acidic. Your brain needs oxygen, but all your brain is getting is CO2. So when your brain gets CO2, it starts to send, it gets it for a little bit, and then it starts to send out distress signals. And these distress signals are you're feeling lightheadedness, you're feeling dizzy, you're feeling nauseous, because the brain needs oxygen. Because it's not natural for us to wear masks over our faces, especially for long periods of time. Therefore, if you get a chance, take it off. Don't leave it on. People have passed out in their vehicles simply because they left their masks on. Please take it off.
Yeah.
When you're with people, you put it on. When you're at work, put it
Oh
on.
my God.
But when you're in your car, please take it off. When you're in your private space, take it off. If you're in a place where, but then I also think that a lot of people do not know how to wear their masks.
Correct. A lot of people don't. This mask of a thing, a lot of people don't. And of course, a lot of people have different, we have this type of mask, we have the cloth mask, whichever one is suitable for you that you have, that's okay. And some people need to understand that there is the one that can be reused and there's some that cannot, right? So it's very important that people take note of that. So, of course, this is a surgical mask that I have here, right? And people will usually wear it the other way around, but people don't know that it's the part that has the iron, that has something like a rod inside of it, that goes on the nose so that you can adjust the rod to fit on your nose properly.
Yeah, your nose bridge. Yeah, you have to
Yes, the
press
nose,
it
yeah,
against your nose bridge. Yeah, it fits
exactly.
tightly.
Yes, but a lot of people don't know that because the mask is very easy to wear. All you have to do is make sure you're putting it and you just put it in your face. So there is no need trying to touch here and then you want to put it and then, no, it's pretty straightforward. So we already have this, but just make sure all masks are the same thing. You can always feel the rod. You will know the difference because the weight is quite more. You can feel that here is just empty. Now, the most important thing that we need to know is this is not reusable. It has to be disposed of. They are called disposable surgical masks. So people need to understand this. This is not something that, oh, I'm just going to, I know people who do that. I'm going to soak it in hot water and then I'm going to wash it and dry it up in the sun and then reuse it.
Wow.
But people have their different reasons. I might not have the funds to be buying masks all the time.
Yes.
For me, I think it's quite fair that people do that because you take the effort in soaking in hot water, adding a little bit of bleach, and sunning it on the sun. I think that is fair for you to reuse it. That is good. And I actually tried it. I experimented on that. And for me, it felt refreshing. It was, of course, you might not get the same feel like it would be before, because it would be all roughed up and feel, but I appreciate people who go through that length to make sure that it was well sanitized. But on the most important note is that these are not reusable. The ones that are reusable are the cloth face masks, even though we're not encouraged to wear them, right? But if that's what you can afford at this time, fine. Those can be washed. And just the way I said it, you can soak them with bleach, in a warm water, and wash them well and dry them on the sun. Or you can use a hand dryer, anything that can produce heat to dry it up properly, right?
Quick question,
Yeah.
Dr. Isioma. So I actually have a couple. So in view of the fact that masks can be of shortage, how many days, for instance, would you recommend that someone wears a disposable mask? If at all, we can do that. For how many days do you think a person can use one disposable mask and then puts it in the rubbish bin. Because like a Kleenex box that you use one Kleenex and trash, and you have like 200 more in there. You know what I mean?
Well,
And it's
yeah.
quite costly. So do you think we can try using it? Because I believe this. Now, I can be wrong. I think it's a disposable mask. It's supposed to be taken off. But because masks are hard to come by, like Dr. Isioma said, when we use it, we soak it in warm water and soap, and then you sun it, or you use a pressing iron, right? You use a pressing iron.
Yeah.
Okay, use a pressing iron to dry it and then use it again. However, if we keep it, okay, the thing is, the blue part is the outside part. The white part is the
It's for
inside part.
you.
So as
Right.
long as you keep that part inside, because I think that's a problem that a lot of people are facing with the cloth mask. It doesn't matter as long as they have the mask over their face. No, the outside part is trapping droplets, infective droplets. So if
Yeah.
you use it now and it traps the droplets on this outside part, and then next time you're wearing it, you flip it around, you are actually inhaling everything that was trapped.
Exactly. Right. That is it. That is it. That is it. That is
And you
it.
put on the mask. So you have to make sure that you mark what part goes to your face and what part goes against your face. That way you wear it the same way every time. With a surgical mask, it's easy to identify which part is the outside part and which part is the inside part, so that
Mhm.
you don't put the part that just trapped droplets back in your face and you're inhaling that. So we have to be careful, because the things that we're using for our safety purposes can very easily be detrimental to us, depending on how we utilize them.
Exactly.
So when you keep it this way, sure that you always wear it the same way. If you start wearing it the wrong way, then you better stick with that, because you already trapped a lot of droplets wearing it the wrong way. You can't switch
True.
now.
True. True.
You can't
True.
switch now. So you better just go with the flow until you're done using that for the day. Then you trash it. But with the cloth mask, make sure you also maintain that regiment. Let the part that's against your skin always be the part that's against your skin. And the part that is on the opposite side always stays on the opposite side. So if you
Mhm.
have a marker that does not wash off easily, mark the inside part, mark the outside part, and use it as such. So another thing that we also wanted to talk about is wearing gloves.
Right. Okay. I am all interested in learning
This
of
is
this.
because, you know, let me use myself. I often like to use myself as an example, because then I tell you what I do and what I don't do. So,
Correct.
and I might be wrong, of course, but what I do is, especially when I go to the grocery store, I always like to use like the wipes, right? Disinfectant wipes on the cart, like when I'm pushing the cart or the basket, right? I like to use it in that area. And I use it just precisely when I'm entering the store. When I'm entering the store, I use that. You should be careful. Be conscious of what you touch while you're in the store, because you don't expect to wear gloves to touch the surface that everyone else before you have touched on the shopping cart. Then you touch the fruits in the markets, right? And then you touch your phone with the gloves on. Then when you get to the the registrar's point, you pull out your wallet with the same gloves on.
Well,
Do that. You don't do
yeah.
that, because now what you're doing is you have trapped it in your gloves, on your gloves, but now you're using your gloves to distribute the contaminants. Because after you take off those gloves, some people don't even take it off after they leave the store. They take it into their car and they're touching their steering wheels. No, you just went into the store and grabbed coronavirus, and now you brought it into your vehicle, and it's on your phone and your wallet. Then you're taking it home with you. You want
Exactly.
to change the gloves as often as possible, because you use that hand and you touch fruits. And that's why every fruit that comes from the store, please wash it before you consume them. Because you don't know if the person that touched it, this contaminated the outside part, right? The coating of the fruit. So please wash it. And those wearing your gloves, after touching the shopping cart, the handles of the shopping cart, take the gloves off before you pull your phone out, before you pull your wallet out. Don't take the same doing a disservice to yourself, using the same things that you're supposed to use for your protection against you. So let's be very conscious of that, okay? So that's one thing I just really needed to put out there.
Yeah,
So,
it is very important. It's very, it was funny. Just to give an example, because over here, when Corona started, a lot of the banks. I went to the bank and they had gloves on. I was so disgusted because I'm like, you guys are still using the same gloves you attended to me with, to the next customers. You collect the same pen, the same paper. I'm like, this is very redundant. You need to stop. I don't know who spoke to them, but it actually came off it and they had it. I'm like, just sanitize your hand. You can't be wearing gloves and to do the same gloves to do everything. You
you're
have already
taking from the
sprayed
previous
the gloves.
person. Yeah, you're taking from the previous person and giving to the next person.
Yeah.
That's why I take my own pen. I always have my own pen. I always have my own pen.
I have the same. I have like actually 3 pens in my.
I have a lot
purse.
of pens in my purse. No, I like my pen, my own pen. I say no, I've got one.
Yeah.
I look for it. If they say, but no, I say no. Give me a minute. I gotta look for my own pen. I need to look for my own pen to use. I want to touch that one. So just do your part and use the tools that are meant to protect you.
Correct.
For your benefit, not against you. Because it's easy for these things to be used against us, especially with the pandemonium. Everyone is afraid. And another thing I want to talk about, I know I discussed it in my initial recording, but guys, you go see a doctor when you are sick. You do not go see a doctor when you're not sick. The doctor gives you antibiotics when you are sick, when you have a bacterial infection. He or she does not give you medication when you're not sick. So therefore, I know there is this thing going on, people mixing concoctions left and right, garlic, ginger, salt, tomato, pepper, everything, and drinking.
Right.
Guys, it's not a local antibiotic. There's a reason why back mixed up and given to you, and you drink and you feel better. If you do it when you're not sick, especially if you overdo it when you're not sick, it can actually be detrimental. Let's take, for instance, you take antibiotics. What does antibiotics do? It goes into your system and it rids you of both the good and the bad bacteria. Needless to say, there are 2 kinds of bacteria. The bacteria that protect us against other bacterial infections and the bacteria that make us sick, or a saturation of the good bacteria, it can make you sick. Too much of the good bacteria, like E. coli. We have E. coli in our system, right? It helps us with digestion and everything else. But then, too much of it, when it exceeds the natural threshold, it becomes an E. coli infection, right? So now, what does antibiotic do? It cleanses you from both good and bad bacteria. Now you're vulnerable, extremely vulnerable to contract any viral infection, any bacterial infection, even parasitic infection. In fact, especially parasitic infections. So when your immune system is that vulnerable, there's the reason why doctors will put you on probiotics after a bout of antibiotics, so that you can build a new brand of your normal GI bacteria, the good bacteria again. So what they do, what antibiotics do is, when it takes both of these away, which is synonymous, very much so, like the concoctions that are being mixed up together and drunk, right? It rids you from all manner of bacteria. However, people do these concoctions, drink them before they go to work. They drink these concoctions going to the front line. So you're
Yeah.
essentially, let's really simplify it here. So you're essentially leaving your suit of armor at home, and then you're going to the battlefield. You have no ammunition. You just suppress your immune system, and then you're going to the battlefield.
Right.
How are you gonna fight? You need your good bacteria. You need a defense mechanism, but you just left your defense mechanism at home by drinking things that acts like antibiotics and makes you vulnerable to infections. And now you want to fight coronavirus with your immune system down? No. So you're doing more harm than good to yourself. I've not said don't drink it forever. I'm saying that even if you want to do something like garlic and ginger, it shouldn't be something that you take 6, 7, 8 glasses a day, because these things don't have measurements. There's no
Right.
dosaging with these things that they drink. One person drinks, oh, their 1 cup is like your 3 cups. There's no measurements for this. So you want to be careful, and also be careful not to give it to children. The little
Right.
one, their immune system is still developing. So the last thing you want to do is suppress it even further with these mixed concoctions.
Yeah.
So we want to be careful, because even ingredients like garlic, ginger, they are so acidic, very acidic, that are used in some cancer treatments. And you
Yeah.
know how cancer treatment functions. It doesn't go into the system and select, okay, this cell is diseased, so I'm going to blast this cell and I'm going to let this cell go. And no, it takes
Right.
everything in its way. It just, okay, out. You know.
Exactly.
So if these things that are used for cancer treatment, and knowing as how they really just blast all the cells in the path, when you take it when you are fine and healthy, it blasts the cells, making you very frail and vulnerable. So that's why we're asking that even as you take them, be very careful, be aware of the consequences. But if you
Yeah.
want protection, go the natural way. Eat right, eat a balanced diet, take vitamins, especially zinc, because zinc has a way of enveloping viruses and inhibit them from breaking out of the host cell,
Yeah.
so that it minimizes the spread and the progression of the disease. So take your vitamins, eat vegetable, eat fish, do vitamin C, take it, exercise, make your immune system robust naturally. That way, when it comes, you're ready to fight. Your body is ready to fight it.
Yeah.
Not leaving your ammunition home. And be careful with children, because they're still developing. As we expect them to develop in their height and their weight, we also expect them to develop. So if you suppress it and quantity in terms of, okay, this quantity is for an adult and this quantity is for a child. No, you're depriving their system from actually like just growing more robust the natural way. Okay. So I just thought I'd add that. Let's be careful about the things we put in our system, because it can either make us or break us in terms of coronavirus spread.
Correct. Correct.
Okay.
Yeah. Well, that's important. There's nothing to add or
So
subtract from that.
that's what I have.
Yeah.
So if you guys have any questions, let us know, and just comment at the bottom of the video. As a matter of fact, subscribe so that when we make more videos, you will get the notifications very quickly. We will also like to learn from you, as we hope you learn from us. We'll also like to learn from you.
Yeah.
So you all remain blessed. Bye-bye.
Bye bye.